currently a communications manager with the County of Los Angeles. Welcome to our second town hall meeting on the Dominguez Channel Odor incident. We've assembled the top county and state officials working on this issue to provide brief updates on the status of their efforts and to take questions directly from you, the public. After their agency updates, we'll shift to a question and answer session so we can address questions and concerns from you, the community. The questions presented tonight will be a combination of those received online prior to this event and those that are entered directly into the comment section of your social media channels. A quick note, this town hall tonight is meant especially for the community members who are being affected by this incident. If you're a reporter or a member of the media, I ask that you please email your questions to our media inbox at pio@ceoem.lacounty.gov. Now, before we get started with our agency officials, we have a brief message from County Supervisor of the 2nd District, Holly Mitchell.
Good evening, and thank you for joining us again for our second, I believe, virtual town hall on the Dominguez Channel. As I've stated before, you know it is my priority that we get information and relief to all of you as quickly as possible, and that you're keeping informed on the progress being made to address the horrific odor that we know is coming from the channel and has been coming from the channel now for almost a month. I am working very closely with Supervisor Hahn, and together we recently passed a motion to create a relief program for you all residents to help cover upfront costs in addition to reimbursement so that you have access to air purifiers, filters, and a hotel stay if you need it. I want to remind everyone that is impacted by the odor and that needs support in applying for the relief program that you can call 211. Again, you can call 211 to get support in applying for all of the relief efforts I just mentioned. So today we're going to focus more on answering your direct questions. We've received a few in advance and we'll take questions live today, so get ready. But again, if you can just remember 211, they are here to provide you with support. So again, I want to thank all of the county departments that are continuing to work tirelessly to address this issue. Please know they are continuing to be present daily to both troubleshoot and problem solve, and we are working tirelessly to, number one, fix the long-term problem, but most importantly for all of you right now is to address the odor and mitigate it as quickly as possible. I thank you for tuning in today. Ask that you contact your family, friends, and neighbors and ask that they tune in to get current information about the Dominguez Channel. Thanks, everybody. Appreciate you participating in today's town hall.
Thank you, Supervisor. Now let's hear a brief update from our 3 subject matter experts. First up is the Director of Los Angeles County Public Works, Mark Pastrella, following Director Pastrella will be the Executive Officer of the South Coast Air Quality Management District, Terrence Mann. And then we'll wrap up those updates by hearing from Los Angeles County Health Officer, Dr. Muntu Davis. Director Pastrella, the floor is yours.
Good evening, and thank you for joining us here at our town hall meeting. Before I begin, I want to thank you for continued patience and for attending to the town hall meeting today. I also want to thank county and city, state, and federal officials that have been working together to resolve the odor incident affecting communities in the area of Dominguez Channel. Now, these agencies include the City of Carson, LA County Department of Public Health, LA County Fire, Health, Hazmat, South Coast Air Quality Management District, LA County Sanitation Districts, Ports of LA and Long Beach, the State Water Board and Regional Water Quality Control Board, the Army Corps of Engineers, California Fish and Wildlife, EPA, and other regional, state, and federal partners. Our top priority continues to be the safety and health of the public. We're making progress in reducing the smell in the Dominguez Channel. and we are committed to our core values, including transparency, inclusivity, and equity. So let's begin with a recap. On October 7th, Public Works was notified that a foul odor was coming from the Dominguez Channel. We brought in personnel to investigate and discover decomposing material in the channel. We've activated our emergency management team in full force and began remediation immediately. Now, our water sampling tells us our efforts are working, so we are ramping up and making good progress and seeing a downtrend in the sulfur, hydrogen sulfide that's creating this odor that you're all experiencing. Again, we recognize this continues to be a trying time for the community, and we thank you for your patience. Now I would like to introduce Terrence Mann, the South Coast Air Quality Management District Deputy Executive Officer over Enforcement.
Thank you, Director. South Coast AQMD continues to be fully deployed in the field and also using all of the tools that are available to us to address this issue. That includes mobile monitors, handheld devices, air sampling, and our robust fixed air monitoring network that is spread throughout the community. We've also added an additional monitor at 213th Street and Chico Street, located closest to the channel and the closest residents to the waterway. That monitor continues to show elevated levels of hydrogen sulfide H2S in the middle of the night and early hours of the morning, although those numbers have been decreasing over recent weeks since the Department of Public Works began taking mitigating efforts. We have also seen a steady decline in public complaints. Yesterday, however, there was a spike in odor complaints starting late in the evening, around 8 o'clock. It started in Carson and appeared to work its way south. And by the end of the night, most of the complaints we received were in the city of Wilmington. Our inspectors were out in the field and taking measurements, also addressing the odors themselves. We did not identify elevated levels that would raise health-related concerns. However, we understand it continues to be a nuisance and to have impacts on members of the community. Our agency continues to assist the Department of Public Works, Public Health, and LA County Fire Hazmat, conducting air monitoring and supporting their efforts. All of the agencies are especially focused on schools and residential communities. And when we identify, and this hasn't happened recently, but in the past, when we identified levels of potential concern, we immediately contact our partner agencies and deploy inspectors and take whatever other steps are necessary. This agency will continue to work with our partners to investigate all potential sources, and this continues to be an ongoing and active investigation. We encourage members of the public to continue to use our complaint hotline and to report odors to South Coast AQMD at 1-800-CUT-SMOG. That's 1-800-288-7664, or use the online complaint system that can be found at our website at www.aqmd.gov. And now I would like to turn it over to Dr. Muntu Davis, Los Angeles County Health Officer with the Department of Public Health.
Thank you so much, Mr. Mann and Director Pastrella, for all your work. And thanks to everyone who's joining us today and for those working in the background to make sure all of this can take place. I want to let everyone know, we continue to be, as the Public Health Department, in the community of Carson. We've had team members canvassing Carson neighborhoods, talking to business owners, as well as going to schools to share our latest health recommendations, which are available online at lacounty.gov/emergency. Again, that's lacounty.gov/emergency. And we've also been answering questions and providing technical assistance on how to reduce odors indoors. So far, we've visited more than 10,000 homes, more than 200 businesses, and all of the schools in the community. And what we hear time and time again, and we continue to hear this, is that people are frustrated and worried. I want to assure everyone that Los Angeles County Public Works continues to diligently work to get rid of the hydrogen sulfide odors and address the issue causing them, while AQMD, as you've heard, continues to monitor the air quality and report levels. and Public Health, in consultation with AQMD, County Fire Health Hazmat, and state and federal environmental health and hazardous material advisors, continue to reassess both the situation and the actions recommended for the public to mitigate or lessen or prevent the health effects, or any health effects that may come from this odor. I know there are a lot of questions, particularly about hydrogen sulfide and if there are any serious health concerns after how long people have been smelling it. And in most cases of contact with hydrogen sulfide, your symptoms are usually related to how strong the odors are and the way your body responds to those odors. And we often refer to this as a physiological response. Contact with hydrogen sulfide may cause symptoms including headaches, sometimes accompanied by dizziness, irritation of the the eyes, nose, and throat, and lungs, which may be accompanied by tearing up and coughing, nausea and abdominal discomforts, which in some people may lead to vomiting. Sometimes symptoms may appear earlier or may be worse in people with existing heart and lung conditions, such as asthma, where in that case, the smell of hydrogen sulfide may cause an asthma attack. Since the beginning of the incident, hydrogen sulfide readings in the air have been low enough that these symptoms are expected to be transient, short-term, and reversible. It's important to note that the symptoms are due to the smell of the odors and are not expected to be due to hydrogen sulfide accumulating in your body. In other words, symptoms tend to go away when you leave the area or when the odors decrease or are no longer present. Some have expressed concern about how long the smell has been in the area and want to know if they should be concerned about exposure to hydrogen sulfide over several days, weeks, or even months, even though the levels are low. The answer is that based on what we are currently seeing, we generally do not expect people to develop long-term medical issues after this odor event goes away. Hydrogen sulfide is a gas that doesn't stay in your body for very long. In other words, your body clears it rather quickly, which means that low-level exposures do not tend to pile up inside your system, even after you're exposed for several days or even weeks. What this means is that the severity of health effects from hydrogen sulfide are related primarily to the level found in the air, and much less so to the time that you're exposed. Most medical studies that have examined the possibility of long-term permanent disability after hydrogen sulfide exposure has shown that this tends to occur after an individual experiences extremely high-level, short-term exposures in the range of 40,000 parts per billion for over 10 minutes. The Environmental Protection Agency has determined that you would need to be exposed to about 27,000 parts per billion for an hour straight, or 17,000 parts per billion for 8 hours straight to be at risk for permanent or irreversible health effects. These levels are much closer to potentially life-threatening levels as opposed to the levels that AQMD has been reporting during this event. Although some outdoor 1 hour average readings in the air occasionally reached as high as 7,000 parts per billion, these levels have been transient and fleeting and occur mostly at night. During the day, outdoor readings have consistently come down and lately have been hovering in the 1,000 parts per billion or less range, which most people can easily smell. The takeaway here is that the levels have not come close to the levels that are expected to cause permanent, irreversible, or long-term health effects. Yet these levels are considered to be a public nuisance that must be addressed as has been directed by our department. As public health has been advising, people with pre-existing medical conditions, especially heart or lung conditions, should work closely with their healthcare providers to determine the impact of this exposure on their medical conditions and ensure they have adequate supply of medications throughout this event. Two specific areas that we expect more questions about include hydrogen sulfide and its impact on birth defects and lifetime cancer risk. It's not fully established whether hydrogen sulfide causes birth defects in people because we can't do those studies. Those are actually unethical. However, the results of studies in animals, where we get a lot of our information about chemicals and birth defects, suggest that exposures to low concentrations of hydrogen sulfide during pregnancy does not cause birth defects. Published studies to date have not shown hydrogen sulfide to cause cancer in humans. That said, public health does have some very specific health recommendations for residents. And again, there are some things that you can do during this odor event. And first is if you feel like your symptoms are life-threatening at any time, please seek immediate medical care. And if symptoms are persistent, worrisome, or worsening, seek medical attention and relocate to another area until the odors go away. As mentioned before, you can call 211 for relocation assistance. Residents should also avoid lengthy outdoor activities between the hours of 9 p.m. and 8 a.m. That's typically when we've seen levels higher, even though they're much lower than they were at their highest point. And they should also do this whenever odors are strong outdoors to reduce exposure. And as mentioned previously, residents should keep their doors and windows closed as much as possible to prevent outdoor odors from entering their residence or business. Residents and businesses should also air out their home or business when odors are not present. If you have central heating, ventilation, and air conditioning or an HVAC system, contact an air conditioning specialist if you need to, and most people can do this on their own actually, to determine if the air filters in your system may be replaced with what we call HEPA or MERV-rated filters with activated carbon to improve the air quality inside your residence. If you notice the odors are stronger or symptoms are worse in the late evening or early morning hours, again between the hours of 9 p.m. to 8 a.m., try running your HVAC system throughout the night, and if you haven't done so already. Temporary relocating may be best if this doesn't help. And residents should use a portable HEPA indoor air filter with activated carbon to improve air quality in their home as well, if the other doesn't work, or if you don't have central air conditioning or HVAC system. And again, if you notice that your symptoms are stronger or worse during those late evening or early morning hours, try running the portable filter throughout the night and in the room that you're in. And if that doesn't help, then temporarily relocating may be the best option. And finally, please keep pets indoors. If you notice any difficulty breathing, vomiting, extreme tiredness, or nausea with your pets, please contact your veterinarian. For businesses that may be impacted by the foul odors, if you've noticed odors are stronger inside your building during the hours that you're opening in the morning, we recommend that you run your air conditioning units 1 to 2 hours, if possible, before on-site operations begin. Doing so will increase airflow inside your business and help reduce any odors present that may have built up overnight. For more information on protective measures to prevent odors from entering the home, residents can contact the Public Health Community Line at 626-430-9821. You can see it on your screen here. Again, that's 626-430-9821, and leave a message with your contact information, and your call will be returned. That message line is checked every hour between the hours of 7 a.m. and 10 p.m. every day while the odors are present. Thank you. And now I believe we'll start answering some questions.
And thank you, Dr. Davis. And I know that those public health recommendations are on the incident website as well, which is listed on your screen. We're now going to turn into our question and answer session. For our panelists, I'll read the question aloud and then redirect you as appropriate to answer. Please ensure your video is on and that you unmute your mic before you respond. So the first question is one that we all have on our minds, and I'll direct it to Director Pastrella in Public Works. When should we expect the odors to subside?
We expect the odors to subside when the hydrogen sulfide that's emanating from the channel is reduced to a level that it no longer affects human smell. And we're making great progress and have a great downward trend going currently within the channel.
Okay, second question, also for Director Pastrella. When and where can I submit my receipts for reimbursement for my air purifier?
Okay, for all these questions regarding the reimbursement program, I want to start out by referring everyone to our 211 help desk number. Please refer to the Dominguez Channel Odor incident when you call the number, and a customer care individual will take your call and answer your questions, all your particular questions. For this particular question, be aware that anyone that's made an application for reimbursement, you'll be receiving an email, a direct email to you with directions for receipt submittal to the department within the next 24 hours.
Okay, the next question I'm going to direct to South Coast AQMD. The odors seem to have started after the earthquake in Carson. Have any investigations begun to see if there is a correlation with that and the surrounding refineries?
Yes, absolutely. Our inspectors continue to investigate the refineries, other plants and facilities, and other sites adjacent to and near the Dominguez Channel, based on the theory of could something have been shaken loose or otherwise emissions created by the earthquake. If memory serves, I believe that was on September 17th. But my staff is aware of that, has charted it out, and we continue to look at that among all the other sources that we are considering. We are attempting to rule out as many things as we can, and we will continue to do so until the end of this incident.
Okay, and I'll go back to South Coast AQMD on this. Is there a list, or why hasn't a list of chemicals beside H2S been released to the public?
I would say that, yeah, right. It's not an issue of that there is a laundry list of chemicals to present to the public. Hydrogen sulfide, H2S, is the only chemical that my agency and the others participating in this investigation have identified as directly being caused by this event, by the event in the channel. If you refer to our website at www.aqmd.gov, and there you will immediately see a banner with a link to a dedicated web page for this incident. On that page, there will be a description of the efforts we've taken, the types of sampling and monitoring we've done, including, for example, volatile organic compounds, or VOCs, and other types of toxic air pollutants, such as benzene. I mentioned those in particular because that's what we would expect to see if this were an oil spill or pipe break or a petroleum type event. To date, we have not found those compounds above background levels, and we have no evidence to support that kind of petroleum-related event.
Thank you. This is back to Director Pastrella. It's a two-part question. So what is the long-term solution to fixing this odor issue? And has anything like this happened before in other channels or bodies of water in Los Angeles County?
The long-term solution is to remove the decaying, decomposing vegetation that's within the channel currently, and then to restore that vegetation through a restoration project in the channel. The department will be, the department will also have after action, which will include an earlier monitoring system that will allow us to detect higher levels of hydrogen sulfide. But I want to remind the public that this is a natural occurring event within any natural estuary, and that's what we have here. What's different about this event is that we've had an extended and more persistent release of hydrogen sulfide than we have ever experienced. And in surveying the rest of the country, my partners in the industry, and here in California, it's very rare that an event would last this long with this persistence. So what makes it different. It's not that we haven't experienced it before, it's just that the extent, the length, and the persistence of it is something that is different in this event.
Thank you, Director. Another question for you. What is being done currently to eliminate the odor?
LA County is applying all of its resources, including our partnerships, to bring about a resolution to the odors that are occurring in the channel. This includes a number of activities, including aerating the channel, which is a process by which we are injecting oxygen into the channel, into the water body, so that it more rapidly goes from an anaerobic digestion system, which produces hydrogen sulfide, to one that's acting in an aerobic system, where the decay is due to aerobic activity rather than anaerobic. It's basically bringing back the health to the channel.
Thank you. And a question for Dr. Davis. Can you assure the residents of Carson and other communities that this odor will not have a long-term effect on our health?
I can say that it's not what we expect, given the levels that we've seen. We've actually been in consultation with the State Department of Public Health. We've also been in consultation with California EPA, their Office of Environmental Health and Hazard Assessment. We've also been in consultation with US EPA. And all have said to us, based on the levels that we're seeing, that that's not what's expected.
Thank you. Question for Public Works. I've been running my air purifier 24/7. Will I be reimbursed for the increase in my electricity use?
Okay, for questions like this, I want all residents to, again, call our 211 helpline, and we will walk you through the process for mitigation, prescribed mitigation, and also provide you the information for making claims above and beyond what we're actually prescribing in the mitigation currently. It's available to you. And again, I want to remind all the residents, please call 211. You'll get a live operator and they can answer your very specific questions like the one we have here.
Director Pastrella, how is the channel typically maintained? At what frequency and what type of work is generally performed in the channel?
The channel is maintained annually and it's prepared for its function to provide flood protection for the this area, the area that we're talking about at Carson, Wilmington, and the lower area of the channel. I can tell you that the channel is operating and functioning at full force for its intended purpose, and that is to protect the citizens of this area from flooding.
And a question to South Coast AQMD. Has any monitoring been done at any residents' homes?
Yes. In addition to the fixed monitoring site that I referenced earlier and our robust community air monitoring system, our inspectors used handheld H2S, hydrogen sulfide monitors in residential areas. And so we have gone up and down streets adjacent to the channel, especially when we have identified high fixed monitor readings to attempt to make sure that local residents are safe. And we have also worked with hazmat to potentially go into schools and other types of structures when we identify high levels outside. I can note that to date, indoor readings that we have taken inside schools and other structures have been at safe levels.
Thank you. Here's a question for Dr. Muntu Davis. With Halloween just a few days away, is it safe for my kids to trick or treat outside?
Yes, Halloween is here. It's all going to be dependent on the levels are safe. I mean, let's just put it that way. They're definitely still at nuisance levels. And so whether or not you or your children or others who may be visiting, have symptoms, again, which should be temporary from those odors, is dependent on each individual person. But in general, the levels are safe in terms of people being outdoors. Again, our recommendations are, if you are having symptoms from this, to try to avoid that exposure. But again, levels have been coming down very significantly and are at a safe level. There's nothing that we see at the moment that's an immediate or imminent threat to health.
Thank you. And back to Public Works. Will the time frame of the relocation assistance or the reimbursement assistance be extended?
The reimbursement assistance and relocation assistance will be active as long as the incident is active. So you can just keep an eye on that. You can sort of ignore the dates you see there and count on us to be there throughout this incident.
And another question for Public Works. Director Pastrella, when will I hear about next steps about the claim I've submitted?
You will be receiving an email within 24 hours if you've made a claim application, and that email will direct you on how best to submit your receipts. But also, if you're waiting to hear if your claim is approved, our goal is to be respond to people within 24 hours. If you haven't already heard back after that 24-hour period, please call back to 211 and make an inquiry about your claim.
Thank you. And a question to Dr. Davis. How long before the hydrogen sulfide levels are safe?
Well, the hydrogen sulfide levels are safe now. They can cause hydrogen sulfide. I do want to remind people the level at which California, the Air Resources Board, labels this as a nuisance is 30 parts per billion. That's usually where most people will smell it. Now, if they were to put it at a level that would be an imminent or immediate health hazard, it'd be much, much higher than anything that is put out there at the moment. So again, the levels are safe, but they are a nuisance and they can cause temporary symptoms, as mentioned before.
Thank you. And this next question to South Coast AQMD. Why was the response time for this incident so slow? And when were you first notified of issues in the vicinity of the channel?
I'm sorry, I'm having computer issues, so I've been turning off my camera. I hope you can see and hear me. I don't believe that the response time to this incident was slow. We first received what we now to understand to be complaints for this incident on October 3rd, that Sunday. But as often happens with these kinds of events, and I can note that my agency receives dozens of complaints every day, many of them about odors. As often happens, it was unclear what this was on October 3rd. And some of the complaints were described as, I'm smelling chemicals or solvents. As a result of that, it takes time. We had to go to the location, attempt to identify a potential source, and frankly, interview all of the complainants. Over the next couple of days, we determined that the source was the Dominguez Channel. And so I should be clear of the numbers I'm talking about. I'm talking 7 or 8 complaints came in the first few days. And it wasn't until Wednesday and Thursday of that week that the numbers of complaints drastically increased. And at that point, we understood that there was a much larger issue being experienced, and many more members of the community as well who were being impacted. And so as that process was happening, we reached out to our government partners as soon as we understood the magnitude of the situation, and immediately started working together to try to address the situation.
Dr. Estrella, I can't afford a hotel on my own. How can we get assistance in my household to relocate?
Thank you for the question. Please call 211, make an application for assistance, indicate that you can't afford to make that payment on your own, and we will provide for you to be placed with a voucher in a hotel.
Again, Director Pastrella, are you looking at other neighborhoods beside the city of Carson and West Carson? I live in Compton and have not heard anything about the impacts to our neighborhood.
Yes, we are not defining a geographical boundary or political boundary to this incident. We are actually following complaints, and that those complaints have been forwarded to us directly through, again, our 211 Assistance Center, but also through AQMD as they've been receiving complaints and notifying us. And then in partnership, of course, with our public health department, they've been visiting the surrounding areas whenever they have any notice of concern with the smell. And they've been identifying residents that are in need, different levels of need, and we've been addressing those needs as they are presented to us. Again, if you or a loved one or anyone else you know and your family, friends are experiencing any odors or any effect of this odor, please dial 211 so we can get you the resources you need to address the concerns that you may have regarding the incident.
And I think I'd like to go to South Coast AQMD as well for that question. Has the gas been monitored in the community of Compton or in the vicinity of Compton?
I don't believe that we have had a level of complaints to expand our monitoring routes to Compton, but I will check with my staff, and if complaints from that area are coming in, we will definitely expand our efforts.
Here's a question for public health. How is this affecting our drinking water? It tastes different and showers have been more drying to my skin and hair.
You know, I think that's probably also a question for Director Pastrella, but as far as I understand, the issue is within the channel, which is a wastewater channel that does not connect to the drinking water system or the public water system that flows to houses. But I'd like Director Pastrella to comment on that as well.
Thank you. Appreciate it. So yeah, we've been in touch with your water agencies, identified that there have been there's no identifiable impact to your drinking water. And for those of you that have been concerned about potentially that this water that's in the channel is your drinking water, that is not the case. Your water, for the most part, comes from groundwater that's highly treated and then delivered through a system that's treated again before it enters the home. And again, we haven't had any evidence of the drinking water being impacted by this, and we have been in contact with your water agencies locally to make sure that's the case.
Here's a question from a student in Carson who's not a resident. It seems that everything is being focused on residents of Carson and surrounding communities. What should students do who have become, who've had effects from the poor air quality? I'll direct that to Director Pastrella.
Sorry, I would thought that would be Dr. Davis, but Dr. Davis, you want to talk about what we want our students to do?
Yeah, I mean, so just because we say residents, I mean, that's anybody that's in the area, should adhere to the recommendations that we've provided. If you are noticing any of those symptoms and there are things that you cannot tolerate, or if they're persistent, worsening, or worrisome, definitely, take some action, get out of the area if you can, make sure that you're in an area that has lower odor. But really follow the same recommendations that we've provided in terms of trying to reduce your exposures. But just because we say residents doesn't mean that it's just for people who live there, but it's for anybody in the area or anybody experiencing the odors.
Okay, and certainly this one is for Director Pastrella. What is the solution being used and sprayed in the channel right now, and is it hazardous to residents who are exposed to it?
We're currently using aerators to aerate the channel. That means we're basically injecting air into the water itself. And then if you're out there and you see us spraying, what we're spraying is a natural deodorizer, biodegradable deodorizer that is made of organic materials. So it is not harmful to you if it happens to get on you. It's not it's not meant to get on you, so we don't want you to be in the construction zone. It's not, and it is not harmful to our water as well. We chose it specifically because of its the natural properties of it and because it's biodegradable.
Department of Public Health done into the effects on health for touching surfaces that have come in contact with hydrogen sulfide?
I'm sorry, repeat the question. I missed the first part. For some reason, I didn't have the sound.
Sure. Has the Department of Public Health done any investigation into the effects of touching outdoor surfaces that have been coated with the residue from hydrogen sulfide?
Well, hydrogen sulfide, in this form is a gas, and so it's in the air. I can ask Dr. Rangan, who might be on as well, to be more specific about this. But the expectation at the moment is this is related to the gas of hydrogen sulfide. It's not as if a liquid has been sprayed on the surfaces. It tends to evaporate. It tends to go away as the wind blows as well. So it's not something that we're expecting at the moment. This has strictly been something that's been identified as being in the air. But Dr. Rangan, do you want to confirm that for me?
Yes, hi. That is true. So because this is a gas, this is not something that you expect to stick to surfaces and then become something that would be toxic to your skin if you touch it. So it's something that's an inhalational hazard.
Thank you.
Thank you. And back to Public Works. What is the long-term plan for cleaning the channel?
We will continue to maintain the channel as we do every year to make sure that it's functioning properly, and we will eliminate the materials that have died off in the channel as a part of that, and then restore the estuary to its original condition as a part of our long-term effort to restore the health and the environmental component of the channel. But again, the function of the channel is in solid shape, and it continues to protect the community from flooding.
And will the county cover both air purifiers and a temporary relocation if we're having symptoms?
Yeah, residents should, as Dr. Davis said, work with what works best for you. If you attempt to get a filter and it doesn't work for you and you feel that relocation is necessary, please call 211 and let them know that, and we will get you relocated at our cost.
Thank you. The question for South Coast AQMD. The H2S monitor at 213th and Chico measures in 1 hour averages. Carson residents want to know the actual numbers, not the averages. Are those available?
I don't believe they are currently available on our website, but we are in the process of trying to allow shorter time averages, such as 5-minute increments or others, to give better underlying data to the community.
Thank you. And back to Director Pastrella. Do residents of the city of Long Beach qualify for the reimbursement program? I can smell this odor.
Anyone who can smell the odor is impacted by it will most likely qualify for the reimbursement program. You can get your answer from our 211 help desk, but again, we're not limiting our remediation to a physical or to one city or another. We're actually just seeking residents that have been impacted by the odor to call us so that we can clarify your qualification for the reimbursement program.
And Director, will hotel accommodations be extended until the odor is eliminated?
Hotel accommodations will be extended until such time as the incident is over.
Thank you. And a question for Dr. Davis. If I'm allergic to sulfur, should I leave the area?
Well, I think at this point, if you've been in the area, you have a good sense of how you react to it. And I want to say to everybody, again, if you're even in the same household, you may have or experience different symptoms based on exposure to the odor or to the gas. So I think it really depends on how you are feeling and how you're sensing, your reaction to it, if you have any related to it. And again, if you have underlying heart or lung conditions, do talk to your provider. Talk to them about what you may be experiencing as a result since the odor has started, and consult with them in terms of what may be the best for you. But again, everybody can be different in terms of their reaction and the temporary symptoms that they may see in exposure to the odor.
And then another question for Dr. Davis. I'm a student at Cal State Dominguez Hills. Should I continue going to class?
Again, I think this is, depends on how if you have any symptoms and what those symptoms are and the severity of them, based on being in the area. Again, this is not something that we have seen levels where we say that people need to leave their homes unless they're experiencing, symptoms that are worrisome, persistent, or worsening. And really depends on what you experience in terms of the odor and how your body reacts to it. But otherwise, it's really an independent call in terms of what you can tolerate in terms of your experience of the odor.
South Coast AQMD. Have you ruled out that a broken pipeline might be the cause of the hydrogen sulfide in the channel?
I want to be clear that South Coast AQMD has not ruled out with certainty any types of sources like that to date. We continue to evaluate every potential source from a facility to a pipeline or anything similar. I would note that we have not found any evidence that would support a pipeline break as being the source of this incident. Again, I'd refer back to VOCs and toxic air pollutants like benzene that one would expect to see in that kind of incident.
And again, for South Coast AQMD, is there any particular reason why the odor is stronger at night than any other time of the day?
Our understanding is that it has to do with wind patterns and often wind speeds. What we have identified both through our monitoring stations as well as through personal observations is that oftentimes in this community, the winds die down at night. And so when odors come out of the Dominguez Channel, they often sit there and they aren't blown away or diffused, if you will, by high winds, as often happens during the day.
Corrosion, if I can add, the other thing that, has been advised to us that it may be higher when the tide is lower, in addition to when there's a lack of night, which occurs at nighttime, a lack of light, which occurs at nighttime. During the daytime, the theory is that hydrogen sulfide is not produced as readily. And so nighttime may also contribute to seeing higher levels at that time, in addition to the wind, in addition to the tide and the weather.
A question for Director Pastrella. Why can't helicopters be rented to spray the neutralizer?
Yeah, it's been looked at. That is something we're working on. In fact, you will be seeing shortly drones actually in there because the logistics of having a helicopter that became problematic, gauging the risk to the operator as well as to the community, made a decision not to utilize helicopters for that spraying. But we have found the methods that we're using for spraying are effective in knocking down the odors. So we commenced that activity and we continue to double down on that approach. You'll see more and more activity in terms of spraying over the next 2 days.
And Director Pastrella and also the other panelists may be wanting to chip into this. What is the cause or the source of the gas that's being released in the channel?
The channel is producing hydrogen sulfide due to the decomposition of organic material within the channel. And that decomposition involves a bacteria that operates without oxygen. It lives in an environment without oxygen. And the production of that bacteria growth and therefore decay is causing a byproduct of that decomposition is hydrogen sulfide. Once we eliminate that bacteria by oxygenating the water, we'll see an absolute reduction in the hydrogen sulfide production.
And another question for Public Works. I have additional expenses beyond what's listed on the reimbursement instructions. How do I get reimbursement for those items?
Call our 211 line and let them know that you have additional claims you'd like to make, and they will guide you to the process for claiming additional costs at the county.
The smell appears to be coming from the tub and shower drains in the restroom. Even with the windows and doors closed, we're subject to the smell of this gas. Since we're subjected to this smell day and night, could this be considered prolonged exposure? Dr. Davis?
This is definitely longer than what most may see, but again, it's not at a level that we would expect to cause permanent or side effects, from this, or long-term side effects from this. So again, what people should remember is that what's most important is the concentration, and less important in terms of the time. The levels that we're seeing are not at the levels that we would expect to see long-term complications from this. But again, everybody, should pay attention to the symptoms that they're experiencing. If this is something that is not tolerable or uncomfortable, follow the instructions if you really do want to stay in your home. And if those don't work, then relocation is going to be best for you at this time.
Dr. Davis, the smell is interrupting our sleep. At what point does exposure to hydrogen sulfide become long-term exposure?
Again, the studies that we've seen in terms of looking at in consultation with our advisors, as mentioned, if you have a level of, say, 17,000 parts per billion, and you're exposed to that continuously over 8 hours, that's when you would expect to see potentially long-term health effects. But these levels have not been anywhere near that at this time. I do think that, if it's uncomfortable in terms of the symptoms you're experiencing, at nighttime, and you're constantly noticing headaches during the daytime, then relocation may be best for you during this time if you are experiencing those things, especially if they're worsening, persistent, or worrisome.
Of our town hall, I encourage you to submit questions that you have there in your social media comments section of your browser. A question for Director Pastrella. Who's responsible for maintaining the channel, and can a seal be put over the channel to stop the odors?
LA County Flood Control District. My agency is in charge of maintenance and operation of the channel, and the channel's been there for almost 60 years. Putting a seal over it or capping it would actually capture the gases, but we wouldn't be able to effectively seal it all off. So while that sounds like an interesting idea, it's something that I don't think is feasible because the gas would find ways to escape and probably concentrate it anyway.
And Director Pastrella, what can be done to prevent this sort of thing from occurring in the future?
Thank you, Kirsten. One little follow-up on that last response, too. I want people to know this is an estuary area that's actually regulated by the federal government. It's considered a waters of the U.S., and there's actually a lot of regulations with respect to how we operate within this area down at the bottom of the channel. In fact, the agency, by state and federal law, is not allowed to actually go into those sections. We're in there right now because we have an emergency, and we're working with those federal agencies to allow us to operate within them. What can do to be so we don't happen in the future? We can closely monitor the situation with real-time monitoring, which we will do. We'll continue to work with with citizens and educate them about not releasing anything other than stormwater into our channels, because we do believe that some of the contributing factors that occurred here was that someone actually discharged something into the channel that caused the growth of bacteria that we're concerned with. And so we will continue to operate the channel and protect you from flooding, and at the same time make sure that we don't get pollutants of concern in here that cause the situation that we have currently.
And Dr. Davis, when I walk my dog at night, I feel the effects, and I'm concerned also about my pet. Is it safe for me to walk at night, and are pets safe?
So as we've recommended, between the hours of 9 p.m. and 8 a.m., and this recommendation has stood just based on the pattern we've seen, not necessarily the concentration, that's the time that you're more likely to be exposed, and the concentrations are higher than they are during the daytime. So if you are going out and you're noticing that you're having symptoms, best not to do it during that time. Pets can also experience some of the same symptoms that people can experience, and that's why we recommend keeping pets indoors, especially when odors, just like you, when odors are strong outdoors, they can also experience some similar symptoms. So treat pets the same way, keep them indoors, especially when the odors are strong outside, and watch for symptoms within them as well.
Thank you. Director Pastrella, can this issue impact groundwater or drinking water wells?
We haven't found any nexus to groundwater with this event. The water in the basin does percolate through the ground and into our groundwater. It takes something like 20 years for that to happen. It's cleaned along the way. And then again, when the providers in this area pull water out of the ground to serve to everyone, they treat it again, and then they treat it again in a highly treated delivery system. So it's super unlikely. In fact, I'm very confident that this situation is not in any way impairing the groundwater in this area.
Thank you, Director. And what's the discharge source of the channel? Where does that water come from?
It comes from a 70,000 acre watershed. It comes from your backyards. It collects all of the water that falls all in the area of that 70,000 acres. And so that is the source. It's rainwater running across properties, streets, highways, open lands, gathering in storm drains, and then coming to the channel, and then discharged to the LA Harbor.
And Dr. Davis, I'm not feeling well. I have a sore throat, burning eyes. Is this normal? And can an outside, non-biased third-party company come in and make a determination if hydrogen sulfide gas is okay for us?
So hydrogen sulfide has been regulated by numerous agencies. We actually have a fact sheet that's put out by the CDC's Agency for Toxic Substances and Disease Registry, or ATSDR. That is available on the county website with the instructions. And it's measured by AQMD, who does this all the time in terms of looking at things. And each day that we talk about this, we consult with US EPA, we consult with our state advisors related to hazardous materials to determine if the situation has changed, if there's any particular risk based on the patterns of readings that we've seen so far, the levels that we've seen so far. And so far, at this point, the symptoms that you're describing are what's expected with low concentrations of hydrogen sulfide. Again, these should be temporary and go away when the odor dissipates or when you're out of the area and as the levels come down.
And Director Pastrella, is anyone looking at the damage that might be done to the exterior of structures? Does hydrogen sulfide stick to concrete, or does it cause corrosion of metal, paint, or stucco?
Well, I can tell you that we had this question answered earlier, that it's in gas form. I know that when we're capturing it and it's converting by the deodorizer, it's turning into a salt in our system. But I don't believe that process would happen in the air around homes, and that's what you're asking about. The other answer to that, too, is that we're looking at the concrete in our own channel. We're not seeing any significant damage to that concrete due to the hydrogen sulfide being present in the air there.
And Director Pastrella, if I'm unable to purchase an air purifier or a HEPA air filter, where can I be provided with one?
Okay, you can call our 211, as I've been saying previously, and ask for a customer care service provider to walk you through the application process, and note that you can't afford it, and we will get one to you. The other way to directly get this is to visit our pop-up care centers at the Carson Community Center and at I believe it's Victoria Park in the city of Carson. Both centers can take walk-up applications and can provide you on-the-spot air filters.
And Director Pastrella, if the current solutions aren't working, what's next in the plan?
We believe the current solution is working, and we expect to see good result. We're already seeing good results trending down. So our plan is to continue with the same, and we know that we're going to see an end to the hydrogen sulfide generation in the channel with this solution.
And a question about the reimbursement. I understand the accommodations have been extended to a date in November. Can you confirm what that date is for me?
The reimbursement will be extended continuously as long as the incident is open.
And another question, this is for you, Director. When will we hear from the engineers and scientists?
Well, I happen to be an engineer, and our science group is working behind the scenes to create the solution. They've been on it since the beginning of the incident. I have great trust in them, and it's not only our own engineers in-house of Public Works, but it's scientists and engineers from all of this country, both at the federal, state, and local level who are working on this. I happen to be a professional engineer licensed in the state of California, so you are hearing from an engineer.
We're at 6:29. Is there collaboration with the Federal Environmental Protection Agency to restore the health of the estuary?
Absolutely. We've already been engaging with EPA and our partners at the Army Corps of Engineers. The Army Corps of Engineers are lending their modeling expertise with respect to this situation. EPA is talking with us both from a regulatory perspective because they have regulatory authority over the channel, and we'll be absolutely coordinating with them as we design our restoration project for the area.
Thank you, Director, and thank you to all of our panelists for your time and expertise this evening. As a reminder, the incident website is updated regularly with the latest information. You can see that on your screen. You can also follow this incident for updates on social media at hashtag Dominguez Channel. Thank you all for your participation tonight. Be safe and be well.